Chapter 14, Family Violence. After studying this chapter, the dental hygiene student should be able to, or will be able to, describe signs of child abuse and neglect, describe signs of elder abuse and neglect, discuss signs and attitudes of abused and intimate partner violence situation, discuss role in reporting suspected abuse or neglect, discuss Munchausen's syndrome by proxy, and describe indicators of human trafficking victims. Now, this is a chapter that has expanded significantly from the previous book, and I really appreciate that they now go into human trafficking and Munchausen's, but it is always a difficult topic. So sometimes this hits a little close to home for some people. So just make sure that you are educated well in this area and what our responsibilities are as a hygienist. So first of all, family violence is a global problem. It doesn't matter if you are wealthy, if you live in the Soviet Union, in China, in the Ukraine, in Somalia, Kenya, Australia, the US, it doesn't matter. Canada, it doesn't matter. It reaches all areas of the world, all financial abilities or status, and all social boundaries. The entire dental team needs to advocate to support people who are suffering from family violence and obtain the proper knowledge and skills required to identify and report suspected cases to the authorities. So we have different categories of family violence. So family violence is abusive behavior from one individual towards another in an intimate or family relationship. Those most at risk are children, the elderly, people with disabilities, and women. So think of a time where you were made aware of domestic violence or family violence, and most always it's going to fall into that category, okay? So, or those populations, I should say. So the categories can include child abuse and neglect, and we'll go into the differences of those, intimate partner violence or domestic violence, elder abuse and neglect. Okay, so what are some of the types? It may include physical abuse, emotional, verbal, or psychological abuse, sexual abuse. It's all there. Neglect or abandonment. Sometimes I feel like we're abusing the elderly through COVID right now. Financial exploitation. Think of some of those elders that maybe their kids are neglecting them, and unfortunately I've seen this where the children are neglecting them because maybe they aren't worth the money that they're going to put into the patient. Okay, so all things that we need to look at. So here's that list again: physical abuse, emotional, verbal, or psychological, sexual abuse, neglect or abandonment, and financial exploitation. On the next slide, let's flip to the next slide. You see here different meanings of each of these categories, of a lot of these categories. And you do absolutely need to know this for your boards. So make sure that you know what each of these means, what abuse versus neglect is. You definitely want to know the difference between those. And I believe you've had that in your special needs course. I feel like I saw an assignment or something about that in that time. But when you look at neglect, it's willful or unwillful failure of the caregiver or parents to provide necessities to the individual in their care. So abandonment, medical, dental, and deprivation neglect. Then we have physical violence, which is non-accidental injuries. Okay, these are purposeful injuries on family members, by caregivers, by parents, by spouses, siblings. I would also say boyfriends, girlfriends, domestic partners, whatever you want to call two people that are together. So make sure that you are understanding the differences between all of these, okay? All right, so there's just a few terms here that I really want you guys to know and understand. According to the World Health Organization, child maltreatment is the abuse and neglect that occurs to children under 18 years of age. It includes all forms of physical and/or emotional ill treatment, sexual abuse, neglect treatment, or commercial or other exploitation, resulting in actual or potential harm to the child's health, survival, development, or dignity in the context of a relationship of responsibility, trust, or power. So that's the World Health Organization. So terms that you need to know and understand is child abuse, again, non-accidental, okay? So this isn't an accident. This is purposeful, physical, emotional, or sexual acts against a child. Then we have neglect, and that's the intentional or unintentional failure to provide for a child's basic physical, emotional, educational, and medical or dental needs. Then we have dental neglect, and this is the willful failure of a parent or guardian to seek and follow through with treatment necessary to ensure a level of oral health essential for adequate function and freedom from pain and infection. So I want you guys to really look at this and think about this, because we don't have universal health care. This says willful failure, so the parent knows that it's there, but remember, sometimes it is a matter of, do we put food on the table for all the kids, or do we pay for this tooth extraction? There are people in that situation, and that's why I feel professionally it is really important for us to give to food shelves, give to our communities, and understand the area that we're living in, and make sure that we can help those that want to do the right thing and give them the vehicles to do the right thing, okay? Because not everybody has the same support system or oral health knowledge and understanding to make the right decisions, okay? So let's look at child abuse and neglect. We have different risk factors. So those at greatest risk for abuse include males. Okay, we've all seen the Catholic Church abuse. I don't want to call it a system, but the long-standing abuse that happened in there with young men, young boys, I should say. Younger children are more vulnerable to death as a result of child abuse and neglect. Children with special needs, you know, those parents of kids with special needs, they have a lot of pressure on them, and sometimes, unfortunately, it comes out as abuse and neglect. Persistent crying or having abnormal physical features are more at risk for abuse. So what are some of the consequences of abuse? Thousands of children a year die from severe physical damage, and others suffer permanent brain damage or permanent physical deformities, as well as emotional trauma. And we can't underestimate trauma, emotional trauma in a child's life. There's a lot of research going into trauma and its effects on behavior right now. And it is so significant. I'm hoping even in our next edition of this book that we'll see a little more education on emotional trauma. So keep that in mind when you're seeing children that we don't know. There's medical trauma, there's emotional trauma, there's so many different types of trauma that you don't even you can't even imagine the levels that it goes to. And we've studied it more in adults, and now it's really coming down the pipeline to the children. Craniofacial and head and neck injuries occur in more than half of the child abuse cases. So who do you think is seeing these children, right? They're either in the ER or they're coming into your chair, all right? And it may have already healed, because generally the parents or the abuser, I shouldn't say the parents, because if a child comes in and you suspect abuse, that doesn't mean it's the parent, okay? It could be another caregiver that maybe the parent is missing the signs, or they just can't believe the signs, right? They're believing the lies or the story that they're being told. So they're coming into your chair, and again, often those are healing or healed by the time they come in. Abuse should be considered in the differential diagnosis for any injury involving a child. And I will say, I know my child's dentist, I was so thankful because she had a torn labial frenum, and they talked to us about it. And I was so thankful that they were looking out for my child. So again, don't assume it's the parents. And if they're innocent, if nothing's going on, they got nothing to worry about. Okay, I am thankful that they are looking out for my child, because how would I have known that her frenum was torn, right? I asked at daycare, she had fallen and it had bled a little. They forgot to tell us, okay? But you know, I wouldn't have known. And so again, the parents may not know that something is happening. So bringing it up in a very non-judgmental way is important. All right, so our general signs of child abuse and neglect, the dental hygiene standards of practice framework promote comprehensive patient care through thorough assessment and identifying risk factors that impede the health and wellness of the patient. All right, recognizing signs of suspected abuse and following proper reporting protocol will promote health and safety for all individuals. Categories of child abuse and neglect are distinguished into physical, behavioral, emotional, cognitive, and social indicators. So, what are some of our physical indicators? The child patient should be assessed for mannerisms, overall appearance, and indicators suggestive of abuse or neglect, especially if they're wearing long sleeves or pants when it's not, say it's a hot day and they're still wearing long sleeves and pants. They may have bruises or lacerations that they're trying to conceal, or even uncleanliness, body odor, soiled garments. Are they being cared for? Why aren't their clothes being washed? Are they being locked into a room? Okay. Infestations of lice. This can be in the form of live insects on the scalp, lice eggs on the shaft of the hair, or noticeable insect bite marks on the scalp. Failure to thrive. Malnutrition. Is the kid, we just went over dietary analysis. Ask them to do a dietary analysis. Their skin may appear pale and they may feel like parchment paper due to dehydration. Might be a little bit dizzy sometimes, lack of energy. So body fat ratio low for the child's age and height is not within normal developmental range. Behavior features. Externalizing is common and may include aggressive, destructive, or antisocial behavior. Okay? Internalizing, or also internalizing is also frequent and includes withdrawn behavior. So what are you seeing from this child? Especially if there's been a change in their home life, or maybe they're in foster care, but they're still coming to you, and you see them kind of a little more reserved than they had been. Impulsivity, inattention, or hyperactivity. Social behaviors. What this is getting at is really develop a gut and go with your gut. Okay? Observe the parent-child relationship. The child may act differently when the parent's in the room, which may provide clues to what type of relationship that exists. Physically neglected children often have more difficulty with establishing and maintaining relationships. Does that child really aim to please? Are they looking to make you happy? Okay, do they need that praise? More likely to use compensation in social settings, such as being the class clown. Are they goofing around to distract from what's going on in their life? Emotional well-being. Neglected children have much lower self-esteem. They have a tough time regulating emotions and may fail to understand negative emotions like anger and sadness. Higher levels of depressive symptoms are seen in physical and emotionally maltreated children. So depressive symptoms, think of what that looks like. Being reserved, being quiet, not making connections with other people, because often they've been told that they aren't worth it. Okay? Last, let's talk about the cognitive features. Neglected children may show lower IQ, along with less developed communication, reading, and math skills. However, neglected children may exhibit well-developed problem-solving skills. Interesting, right? Because they're learning to negotiate around tense situations. So, extraoral wounds and signs of trauma, abrasions and lacerations. Again, they're trying to cover them up, but if they are exposed, you'll see some that are very fresh and some that are healing. And then you know that they're at different times, right? So a fresh one is going to be more of that red and blue, and then a healing is going to be more of the greenish color. Okay, so if you're seeing different shades of bruises, that's a sign of abuse. Recognizing injuries to the head and neck and connecting them to suspected child maltreatment can lead to early intervention and save the lives of the children involved. Accidental injuries usually only on one side, where abuse you might see it more bilaterally. Okay. Common sites of deliberate injuries, skull injuries, and then the raccoon signs. Okay, so think of the dark eyes. Okay, think of that malnutrition that you might have seen in there. So bilateral periorbital ecchymosis. All right, nose fractures, lip tears, pattern bite marks, or any marks on the skin. Sometimes it'll be cigarette marks, little burns all over their skin. So just keep in mind, look at those frenum, make sure that they are intact, and if they aren't, find out why. All right, so here are some common sites of children's injuries. So common sites, inflicted or deliberate injuries, and then are in yellow, and then the common sites of accidental injuries are in the green. Okay, so I mean, we've all seen kids with a ton of bruises on their legs, right? Because they're learning to bike, they're learning to rollerblade, they're learning to ice skate, they're learning all these different sports. They're going to bonk their head here and there, fall on their elbows. But when you start to see broken noses and you lift their hair up and you see a bruise on their back and maybe on their upper arm or bruises on the backs of their legs, that's when the alarm bells should start going off. Okay, so conditions that can mimic abuse, please read through this. Make sure you understand those. They should look familiar. All right, so parental attitude. This is a big thing, right? So reasons for dental neglect, the oral cavity care may be considered a low priority. Some people still look at dentistry as a luxury, and instead of it being health care. And unfortunately, we are so separated from the medical portion of healthcare that people forget that all parts of the body are connected. Lack of education. Okay, what is their oral health literacy? That needs to go into this, right? Limited finances, family isolation or access to care. Again, this is still somewhat under the oral health literacy, right? Religious or cultural beliefs. So common characteristics, disinterest or denial in the relationship to the child, critical scolding or belittling of the child in front of others, including the dental personnel, provides inconsistent information about the reason for the damaged frenum, the damaged teeth, the bruises, any signs of trauma. You're getting a different story every time. Lack of interest in proposed dental and dental hygiene treatment plan for significant oral diseases and dental caries or trauma. If they aren't looking to make it better for the kid and they're okay with the kid being in pain, we need to look into reporting that, okay? Failure to complete a recommended course of treatment despite obvious needs. I remember having a patient, I worked briefly in a pediatric office, and a family came in, and they came from a very, very rural area, and they had a child. Basically, they had 5 kids under the age of 5, or 5 and under. So all of them, including the one that was coming in for his pre-kindergarten checkup, were all in diapers and still on bottles. So we had to report that. That's a definite neglect, right? The 5-year-old was still being put in a diaper, and they all came in dirty diapers. I remember that also, because one of our assistants brought the mother in the bathroom and asked her to please change all the children, and the dentist made the kids throw away their bottles and said they needed to start drinking out of cups, and it was kind of a big ordeal at the time. But I was just in awe. I was just turned 19, and I'm like, what is this? I'd never seen anything like that. All right, contributing parental factors for abuse and neglect: immature and unprepared for accepting the responsibility of parenthood. And that doesn't mean age, because I've seen some really amazing young parents, and I've seen some really not so great older parents. Okay, so that has nothing to do with age. Maturity doesn't have to do with age. Preparedness doesn't have to do with age. Do we hope people mature as they get older? Yeah, but not everybody does. Okay. Many have been maltreated themselves as a child. I know 100%. If they've been maltreated themselves, do they know any different? So that's where we need to look at how can we help these parents understand what's important and what needs to be done. May have witnessed violence as a child, unable to handle daily stresses of financial difficulties, work stress, job loss, and marital conflicts. I'll also say with the special ed kids, there is a lot of added stress to the marriage, to the finances, and just stress in general of managing the care of the child. So, that is one thing I've seen as a parent of a kid that has special needs, just really helping support some of those other families that maybe don't have the resources that I have as a mother. Drug use and alcoholism, maybe that's how they're managing it. Not, that's obviously something we would want to help them with, and we wouldn't do that ourselves. We would call social services and see if they can help them. And know that social services, the last thing they want to do is take a child out of a home. Used to be that they'd take them out of the home a lot easier. Now I think they keep them in the home too long. But they say that research has shown keeping them with their parents is most often the best thing to do. So unless that kid is in real danger, they're going to keep them at home. And so we can have comfort in knowing that, and just maybe giving them some additional resources. Lacking a support network, as I said, special needs parents. Also, when we look at this, we're talking about parents, but a lot of this is going to go towards children of the elderly, okay? And then a history of criminal activity. Community and social factors, gender and social inequity. Boy, that has come to I would even say racial, probably, in their inequity. We really need to keep fighting for the advancement of equality for everybody. Lack of adequate housing or services to support families. High amounts of unemployment and or poverty. And you look at right now, we have such a mixing pot of all of these factors, right? A lot of people are financially stressed. They don't know how they're going to pay for their home or pay for their rent. They don't know how they're going to put food on the table. They've lost their jobs. Alcohol's cheap, so they turn to that as a medication to help them. And we just have a lot of that going on right now. So I plead of all of you. I know you guys are so busy, but look at your community. Take a real look at your community and see where the needs are, because you are a professional, becoming a professional. And as a professional, we have a responsibility to our public and to our peers and our community to make it the best community and healthiest community possible. Social, economic, and health and education policies that lead to poor living standards or to socioeconomic inequalities or instability, increased stress and community isolation, all factors that contribute to abuse and neglect. All right, how many of you guys have heard of Munchausen syndrome by proxy? Oh boy, what was the show? I'm trying to think. I think it was on Netflix, or was it on Hulu? I feel like it was on Hulu. I'll have to look it up. I'll have to look it up. It was a severe case, and where the mother moved around, and Munchausen syndrome by proxy is a type of abuse where a parent or caregiver fabricates or induces a disease on a child. And it's so interesting to me, because I can't imagine wanting what satisfaction or what need is met by them doing this. But it's really difficult to diagnose. The patient presents with a dramatic medical or dental history. Disease does not follow the normal history of clinical presentation and is kind of unsubstantiated. So maybe you're not seeing it, maybe the parent is just reporting it. Okay, it's more commonly initiated by the mother of a child. over half of the mothers are found to be past victims of abuse. So if they are abused as a child, they might have this Munchausen's by proxy, where they continually are bringing their child in for something, and they're making things up. And unfortunately, death of a child can occur with this. It's presented most often in children 2 to 6 years of age. The perpetrator wants to progress to more invasive diagnostic procedures for the child. So they're fighting, even though nothing is adding up, and maybe some of these diagnostics aren't necessary, the parent is pushing for it. The mother's pushing for it. The motive is attention and sympathy from the healthcare professionals, and the child may grow to participate in the deception as they grow older, because that's their norm, right? Gosh, I wish I could think of the name of that show. I'm going to pause this for a second, see if I can pull it up. Okay, so I did look it up. It's called The Act, and if you have an opportunity, it's about Gypsy Rose, and I think there's a couple podcasts on it also. I've heard the story a few times, but it's fascinating and very sad. All right, let's talk a little bit about human trafficking. Trafficking of a person is a way of gaining power over a person by means of threat, of force, of coercion. They could be abducted, deception, by using abuse of power. Sometimes even parents are selling the children, the individuals being trafficked, but just all for the purpose of exploitation. This can include prostitution, sexual exploitation, and forced labor or services and slavery. This occurs in the victim's own country or abroad. So sometimes they could be abducted here, and then they are brought to, Europe or Asia or wherever to do whatever it is that it was intended why they were taken. So I don't know if you guys recall when the Super Bowl was here in the Twin Cities area, there was a real push by the Minnesota Dental Association for dentists and hygienists to be on alert for human trafficking, because there was such a surge of human trafficking being brought in for sexual favors during this time, or I don't want to even say favors, a sexual exploitation during this time or that time. So it's something we really need to watch and be aware of. So those most at risk are definitely the youth who are homeless, or that are currently in foster care or previous history in the system. Could also be runaways or those in juvenile detention centers. Healthcare professionals may encounter a trafficking victim while they're still in captivity. The dental team may be first to render care to a victim. Similar to universal signs of child abuse are observable. So they also have poor living conditions. Victims comply and do not attempt to escape because they're fearful of retaliation on them or even the threat to their family. They can blame themselves for getting into this situation. They often do blame themselves, or they feel indebted to the trafficker because there's such a mind shift that happens in that coercive control. Dental staff must be aware of indicators of human trafficking and be able to provide resources to contact for assistance. So what are some of our indicators of trafficking? A patient is escorted by another person who seems very controlling. They often will want to come into the operatory with them. That person may speak for the patient, even though the patient is completely capable of speaking for themselves. They don't even attempt to. The escort will do it for them. The escort doesn't know the individual's medical history details, or it's really vague. Patients seem very submissive and fearful. They often don't want to make any eye contact. And they may have tattoos or other forms of branding of the owner, and this is part of that sexual exploitation. The tattoo may be a guy's name or nickname in an unusual place, like the back of the neck, the underarm, the inner thigh, and so on. So, when you're doing that EOIO exam, pay attention to that. May show signs of malnutrition or poor oral hygiene. Does it look like there at one time was caretaken of these teeth and now there's not? They may show serious dental disease from neglect, infections, and tooth loss. Treatment is usually cosmetic only. All right, they aren't bringing them in for long-term maintenance or health. That's just not a priority. Okay, so keep your eyes open, because this is a really big deal right now. And as our homeless population is growing with everything that's going on in the world right now, I just feel like we need to have our eyes and ears open more than ever for these individuals. All right, elder abuse. General considerations: 1 in 6 older individuals are have some form of abuse or neglect. Estimated global population age 60 and older will be about 2.1 billion by 2050. So that's 30 years from now, and you think of how old you are. In 30 years, you're still going to be working. Okay? So if the portion of elder abuse remains constant, elder victims will increase to approximately 320 million by 2050. I was just, my sisters were just here a little bit ago, and we were talking about the shortage of nurses' aides right now. And, my naivety, I said, I feel like anybody who doesn't like the elders, because I said, how can somebody work with the elders if they don't like them? And one of my sisters, who's worked in a nursing home a lot, said, a lot of people do, because it's quick training, and you get paid decent as a nurse's assistant. And I said, well, don't you think COVID kind of weeded those ones out? And she's like, no, there are people who just like to abuse. That's a powerful thing for them, to be able to abuse the elderly. And I can't even fathom it. But she's like, it absolutely happens. And then, my husband was telling us about how the nurses were just like, I was just in their room, the light is on, and I was just in there. They can wait until the next time I'm in there. And they would put them on the toilet, and then that person couldn't get off, but they wouldn't go back in there because they had just been in there. And it's like, oh, I didn't know that. And so one of my husband's family members actually was left on a toilet for hours. And that just made me sick and sad. So this is a very real thing. I guess something we just really need to take a look at. And when they come in, we need to look at their oral health, and we'll talk about that in a little bit. But elder abuse affects all socioeconomic groups, cultures, races, just as children, and ethnicities. A longitudinal study found victims of elder abuse are more likely to die prematurely. Elderly women are at a much higher risk of neglect and financial abuse. Widowed older adults who have poor physical health or cognitive impairments are also very vulnerable to abuse. Maltreatment occurs in institutional settings as well as family home environments. So just because they're being kept at home, what is the motivation there for keeping them at home versus putting them in a care facility? Is it because of they want to preserve that money? Gosh, I know my dad was just telling me how he watched one of his friends go downhill really fast, and how several of the friends were trying to get a judge to in social services involved in one of his friends who he watched die rather quickly after his children took over control over all the finances and how they neglected him. And it's so foreign to me, and it happens. And read the books, become familiar with this. Harm to the elder can occur through intentional active infliction or by unintentional passive neglect. So I want you guys all just to take a moment and really think about this. Think of your loved one, somebody you care very dearly, and how they might be treated by somebody else. Because when you have somebody in your chair, remember that there's somebody out there that loves them also. So if you see signs that they're being neglected in their nursing home or in their home, we need to make sure that it's being investigated. Family members are the primary perpetrators of elder abuse. So it's not the nursing homes, it is the family members are the primary perpetrators of elder abuse. The dental team must be vigilant in discerning the indications or indicators of elder abuse and have the proper knowledge and resources to assist elderly patients. The dental team, as in child abuse, can be a key resource for gathering of the information to prove or disprove abuse of the elderly patient. So, just like with child abuse, I want us to go over a few definitions. And the first one is physical abuse. And that's the intentional use of force resulting in bodily injury, pain, and anguish. Physical neglect is the failure to provide basic necessities such as food, clothing, water, shelter, medicine, dental care, health care, personal hygiene. Okay? So this type of neglect can be intentional or unintentional due to the caregiver's lack of ability to provide the care. So that's why what makes neglect a little trickier is, do they have the ability to provide it and aren't? Or is it that they're intentionally taking these things away from that individual? Psychological abuse is the mental anguish and despair caused by ridicule, name-calling, humiliation, harassment, manipulation, threats, and controlling behavior. Then we have psychological neglect, and that is the nonverbal anguish caused by lack of communication and isolation. Is the family cutting them out? Did they drop them off at the nursing home and then they don't come back? That's the psychological neglect. I'm not going to come back if you don't sign this over to me, or you don't do this or that. It's a form of use of power and control, and also neglect, right? So financial exploitation, improper, illegal, or unethical exploitation of resources or assets. I'm not going to come see you unless you give me, you sign over your bank account to me, right? Or let's change your will, all right? Sexual abuse, sexual contact with an older individual who is unable to consent or otherwise non-consensual sexual contact or exploitation. Then we have self-neglect, and this is the behavior of that individual that threatens his or her own health. This can occur owing to depression from a loss of a loved one. So say they just lost their husband or their wife and they don't want to live anymore. So they begin to neglect themselves. That is self-neglect. Okay, so now let's look at some of our general signs of elder abuse and neglect. And just know that you have to have a good working knowledge of how tissues respond in the elderly and medications in the elderly. I'm thinking like Coumadin or blood thinners. You know, if you just bump some of them, they're so frail that they could bruise that easily just by touching their arm. I can't remember. A student was telling me one time they were rubbing their grandmother's arm when she was in the hospital, and she was on a blood thinner, and right where they were rubbing her arm, she got a big bruise just from them rubbing it because she was on so many blood thinners. So we need to have a good working knowledge of the aging process, health problems in the elderly, and medications that they may be on. So taking a really thorough medical history and comparing it, and oral history, and then comparing it with what you're seeing in the mouth to determine if it's appropriate for what's going on in their body and what medications they're taking, or is it not. Okay, so signs of abuse and neglect include being withdrawn, anxious, and shy, providing illogical explanation of how an injury occurred, doesn't match the way they fell or what they're telling you. Okay, if it doesn't match, ask them a little bit more for a little more detail. Okay, depression or hostility, flinching at another person's movement. If you you know, turn around quickly, do they flinch and try and move away in a defensive movement? You know, you could have just startled them, or maybe that's a movement that often is harmful to them. Okay, deferral to caregiver or possible abuser when asked questions, such as, you know, I see you broke a tooth here, can you tell me about it? And they look at their daughter or their son or their caregiver and like, what do you want me to say? Okay, so we want to look for that. And then fear or apprehension when caregiver is present, you know, just like a child. How does their behavior differ? Some of our physical signs of elder abuse and neglect include bruises, bite marks, contusions, or fingerprints, poor personal hygiene. That's going to be our neglect that we often see in the dental office. Are their oral needs being taken care of? Adequate clothing for the season. Are they do they have a nice warm jacket on when it's, you know, 30 below? Scratches or burns, traumatic alopecia, wrapping bruises, patterned marks or bruises, and cachexia, which is kind of a wasting away or a large weight loss. Okay. And here you can see some finger and hand shaped bruises on this patient. You can really see the finger marks. Let me point right here. Oh, that's a really bad arrow. But anyway, these, let me just, that circle got a little out of control too, but right there. Okay, you can kind of see it on the other arm too, right in this area. Be watching for that. That's classic signs right there. So oral facial signs of abuse and neglect, extraoral injuries, you're going to see lip trauma and facial bruising, eye injuries, broken glasses, mandibular fractures or pain. Intraoral injuries, you're going to see fractured or avulsed teeth, sexually transmitted disease lesions or other lesions, and then untreated periodontal disease. Again, the frenum, which kind of goes a little bit with the lip trauma, but sometimes it's just that frenum. All right, intimate partner violence, also known as domestic violence. Again, a global concern, prevalence. Unfortunately, severe physical violence by an intimate partner was experienced by 22.3% of women and 14% of men in the United States. About 47% of women experience at least one act of psychological aggression by an intimate partner in their lifetime. So do read on that. Also, Black and American Indians, Native American women have the highest rate of homicide in connection with partner violence. Physical injury from intimate partner violence injuries frequently involve the face, eyes, neck. Physical injuries can include scratches and bruises, contusions, fractured teeth, fractured bones, abdominal and pelvic injuries, head injuries, strangulation. So, look at voice changes, any trouble swallowing or breathing difficulties in these patients. So general health consequences, in addition to acute injury from intimate partner violence, there's a lot of long-term health impacts for victims of intimate partner violence, and the health consequences include chronic pain, especially in the abdomen and the pelvis, headaches, neck, lower back, GI disorders such as ulcers, irritable bowel syndrome, gastroesophageal reflux. Then we have physical symptoms, which you can see insomnia, fainting, and so on. Increased risk for chronic diseases such as high blood pressure, strokes, and cardiovascular disease. They definitely have an increased risk of sexually transmitted diseases, including HIV, alcohol abuse, and substance abuse. Often you'll see depression and post-traumatic stress disorder, or even suicide, and unintended pregnancy. Oral facial pain associated with this. There is a correlation between intimate partner violence and oral health of the victim. So the head and neck injuries that are fairly common, you're going to see chipped teeth, avulsed teeth, and a fractured jaw. Generally poor oral health. You're going to see more risk for caries and periodontal disease. Psychological impact result in fear of dental treatment due to the loss of control. So what do we do as dental hygienists? We may be the ones to see the oral injuries and the need for referrals to support the person, the victim of the violence. So following hygiene process of care or care protocol to perform thorough assessment and documentation of clinical findings. Are they following through with it? Okay. Practice routine injury, especially for women. General question, do you feel safe at home? Just asking that. So specific questions you could ask, have you ever been hit, kicked, punched, hurt, or frightened by someone important to you? How are things at home? Is it safe for you to go home? So perform and document detailed EO/IO findings, including photographs of any injuries that you suspect. Provide support by encouraging open communication, and don't judge. You don't know why they stay. You definitely don't want to give advice to somebody that could potentially lead to their death. Okay, so be encouraging to help them in whatever manner they need help, and get a social worker involved as soon as you can, okay? But respect and maintain confidentiality. So make sure that you're talking in a private room. Respect the patient's autonomy. Ask, for their decision making. Ask about plans for their future safety. and then prepare to share your findings provided the police call or an investigator calls. When it is possible, the interview will be used in a legal setting. A witness needs to be present. So make sure that you know your role and know what you need in that situation. Reporting abuse, proper training to recognize and report abuse and neglect needs to be implemented in every office. Unfortunately, this gets overlooked a lot, but like I said, there was kind of a surge a couple years ago with the Super Bowl being in town. There's also great training usually on dentalcare.com. Preventive abuse and neglect through dental awareness, or PANDA, is a program for training dental personnel and others interested in preventing family violence. The coalition was founded in 1992 by the Missouri Bureau of Dental Health and Delta Dental of Missouri, and is a public-private partnership committed to the education of all dental personnel in the recognition and reporting of suspected cases of child abuse and neglect. Since that inception, nearly all of the states and several international coalitions have replicated the program. So Ask, Validate, Document, Refer tutorial for a dentist is an interactive tutorial program that utilizes a case study to demonstrate the reporting, the four-step process of reporting in response to domestic violence. So asking the patient about abuse, validating, this is what it stands for, asking the patient about abuse, validating messages, acknowledging abuse is wrong, documenting, referring. Project Radar is a provided focus initiative in healthcare setting to promote assessments and prevention of intimate partner violence. Routinely ask your patient, again, do you feel safe at home? Has your partner threatened you, or are you frightened by them? Document it. Reporting laws, recognize signs and symptoms and follow proper reporting protocol will promote health and safety for all individuals. It is important for all healthcare providers, including dental providers, to be observant and knowledgeable about signs and symptoms of abuse and neglect and to know how to respond. Each state's laws regarding reporting of abuse to the proper authorities or have laws that require us to report. It is imperative to research the laws for the state and have them available for reference in the office. Each dental practice needs a written protocol for documentation and reporting of abuse and neglect, and honestly, I don't think I've ever seen one in any of my dental offices. Reportable required information. Let me back up a second. I haven't seen it, but I've seen a lot of dentists definitely report, and they aren't afraid to report it either. All states mandate healthcare workers to report for children, disabled, and the elderly, and many states have hotlines for reporting child, disabled persons, and elder abuse. There is a national hotline that you can find in your book and other resources. So when reporting suspected child maltreatment, it is necessary to have the following available. So you need the name and address of the child, the parents or other caregivers or custodians of the child's age, name of siblings if they have any, nature of the child's condition, including evidence of previous injuries, and any information that might be helpful in establishing the cause of abuse or neglect, and the identity of the person believed to have caused the neglect, which sometimes you don't know, right? The information needed for reporting suspected abuse and neglect of the elderly or a disabled individual would be similar to that needed for a child. So just know that the reporting is pretty much the same. If you need it for the child, you pretty much need it all for the adult or the disabled individual. And then healthcare workers are required by law to report suspected partner violence in some states, and I think we do in Minnesota. Okay, so now let's talk about forensic dentistry, and that is kind of our area of dentistry that includes dental identification, malpractice litigation, legislation, peer review, and dental licensure. Forensics is a specialty and is not within the scope of practice of any dentist or auxiliary without any advanced training or certificate or recognition. Okay, so you can't just say, I'm a hygienist, I can do dental forensics. That's not true. The use in abuse cases is there's an instance when it becomes necessary to request the aid of a forensic odontologist to determine if a particular injury, usually a bite mark, is a result of trauma caused by a particular suspect. So usually the abuser will state the bite mark occurred from a sibling or an animal, and so it's important that we are able to compare the two, because usually animal bites are very different. They present a lot more different on the skin surface. So when photographs have been obtained and the history of injury doesn't match the location and marks, the bite mark analysis can be requested from the forensic odontologist, and then that forensic expert can take impressions and a bite registration from the suspect or the caregiver, and then they analyze that to see if it's a match. And that's why it's important for us to have some sort of scale of the pictures. The information obtained can then be used in the prosecution of somebody accused of abuse. So what are other uses for forensics? Primarily identification of victims from a disaster such as 9/11 or a fire, or what to confirm who it was. DNA extracted from dentition may be used in identification of victims. Forensic teams include dentists, hygienists, and assistants with special training in the process of identifying remains by comparing the dentition of the remains with the dental records. Team members are assigned a task, and the team works together to check, double check, and recheck the results, along with legal implications. Forensics may allow families of the victims to have closure regarding the loss of a loved one. All right, document, right? For future reference and comparison, are we still seeing bruises at different times, healing? That's why pictures are so important. Make sure that your documentation backs up what the patient has told you. This could become part of a legal case, so make sure that you have dotted all your I's, crossed all your T's, right? And to protect the abused patient from harmful circumstances or even death, a second person needs to be present to witness the examination and the interview. Content to record. Obtain thorough histories of the patient from both the caregiver and the patient. Identify inconsistencies. Document the date, time, and place of the examination. Record all observable facts. Record questions that have been asked. Document all lesions. Again, you can give descriptions and you need to give descriptions, but you should also have photographs. Use diagrams showing the location, size, and description. And scale the photograph. So hold a probe up to it, hold a coin up to it, something to show how large it is. Okay, because if they need to match it to, like I say, it's a bite mark, and they need to match it to a mouth, they need to know how to be able to scale that properly. Okay. All right, so I think that's about it. If you have any questions, please let me know. Oh, sorry. Factors to teach the patient where help can be obtained, tendency for maltreatment to worsen over time, abuse that can escalate and be life-threatening, and maltreatment is a choice by the person who is not treating them well. Okay, even if it's financial and they don't have the money, it's still a choice that they're choosing not to do the care, but rather allocate their finances somewhere else. Okay. All right, so now if you have any questions, please let me know. I tried to not add any graphic pictures on purpose because this can be so emotional for a lot of students, and I do encourage you, if you can handle it, to go ahead. Like I said, dentalcare.com usually has some good pictures for you. All right, thank you. Bye-bye.